All right, good day everyone. So we're having kind of either a early ending of the day or a late start depending on how you're looking at it, but it is Sunday, so Sunday. So you want to be a nurse, then caution, nursing exam ahead. All right, what do you need to know about nursing exams? And it is a big part of you becoming a nurse. You got to master these nursing exams. All right. So that's what we're going to talk about. Here are some study smarter. I want you to study smart and smarter tips on what you need to do. So, what can you expect on these nursing exams, and how do nursing exams differ from other exams? Well, when you enter your first nursing course, what you want to remember is that up to that point, most of your college courses, your support courses, have been primarily testing you at the cognitive level of remembering or understanding. So most of us, after we study and just practice and memorize information, we can recall that information back and we can answer a question or two on it. All right. Sometimes we forget it after that because we just memorized it. And memorization just takes recalling and practicing that information over and over. Now, your support courses are going to be anatomy, physiology, microbiology, chemistry, pathophysiology, nutrition, genetics, and so forth. All right, now these support courses have required not only a great deal of reading, but it has also required that you do a lot of memorization to answer those exam questions correctly. Basically, your test taking skills up to that point may be pretty good, but they're based on remembering, some understanding, and mostly a lot of memorization. All right, now, how are nursing exams going to differ? Well, memorization alone will not, I repeat, caution, it will not get you through a nursing exam. It won't get you through on the NCLEX exam. So now you do need to memorize some content, such as maybe some formulas, calculating a medication dose. But the questions on a nursing exam are going to be at a higher cognitive level, and they will require you to analyze or apply information to a situation. Your exams will require you to demonstrate clinical judgment. And in some of my previous videos, you can review some of the NCJNM or the NGN cognitive skills. I talk a little bit about those on my Test Tip Thursday when we discuss case studies. So they're going to test you on clinical judgment in the delivery of care of patients, and they're going to measure those 6 cognitive skills, those processes noted in the NCJMM, which stands for the NCSBN Clinical Judgment Measurement Model. So you will not be able to rely only on recall to answer those test questions. Instead, you're going to need the understanding of your pathophysiology related to certain nursing content, and you got to understand the disease processes. When you get that, on top of that, you're going to have to use critical thinking and clinical judgment to make decisions on your exams in order to use that process of elimination and some testing strategies to eliminate those incorrect answers to get you to the best choice. So be ready for it. How to be ready for it. How to pass. Well, don't let that first nursing exam blow you out the water or throw you for a loop. You got to be ready. You got to prepare. And you will do great. You will pass. You just got to tell yourself, I'm going to do well. I'm going to do great. I am going to prepare. So you just want to be prepared. So beware of nursing exams. Beware. Caution. The best way to prepare for your nursing exams, as well as the NCLEX, is to review that need to know content and then practice answering. You got to practice answering as many questions related to the content as possible. So the best way to study for an exam is to answer practice questions, because those questions are going to require you to apply the information that you've learned, to analyze it, to evaluate. You're going to use the whole nursing process. You're going to use ADPI, and you're going to use those cognitive skills, because those questions are usually designed at those higher levels of cognitive ability. So you got to amp up your cognitive ability. Get to that higher level. Master that higher level of cognitive ability. So remember, not only just answering questions is going to help you, because you got to go back and read those rationales. Understand why the question was right or wrong. Understand why each option was right or wrong. It is an important part of using practice questions to learn. So I tell all my NCLEX test takers, use the practice questions I give you. Let those questions guide your path of study. Allow those questions to guide your learning. All right. And so as you're getting questions incorrect, it's going to help you see what content you need to review, what parts of your critical thinking and cognitive ability do you need to work on. Okay. So that is how you are going to study smarter and not harder. All right. So study smart and smarter. Those are your nurse exam tips. Next time, maybe we'll talk about, why are test taking strategies important? Any ideas? And are they important? Are test taking strategies important? Why are they important? How can they help you? We'll talk about that next time. So I hope you enjoy the rest of your evening, the rest of your day. And I hope this test tip helps. So you want to be a nurse, you got to master these exams. And this is what you need to do. Have a great night.